Strep throat and the flu are two distinct conditions that often get mistaken for one another due to some overlapping symptoms. Strep throat, a bacterial infection caused by Streptococcus pyogenes, primarily leads to a sore, scratchy throat and difficulty swallowing, while the flu, caused by the influenza virus, is marked by a sudden onset of fever, chills, and body aches. The flu can also lead to a sore throat, but it's more commonly associated with respiratory symptoms like a cough and nasal congestion. Treatment for strep throat typically involves antibiotics to eradicate the bacteria, whereas the flu is usually managed with antiviral medications, rest, and supportive care to alleviate symptoms. Individuals with weakened immune systems or those in close contact with infected individuals face a higher risk of catching either disease. Here's a more detailed look into the aspects of each disease to further understand their distinctions and impacts on health. Causative agent, bacterial versus viral. Streptococcal pharyngitis, commonly known as strep throat, is caused by bacteria from the genus Streptococcus. Specifically, group A Streptococcus is the main culprit, leading to sore throat, fever, and white patches on the tonsils. On the other hand, influenza or the flu is caused by influenza viruses. The flu is systemic and affects the entire body, causing fever, chills, muscle aches, cough, and weakness. Despite some symptom overlap, the flu often presents with respiratory symptoms and a more abrupt onset. Antimicrobial treatments like antibiotics are effective for strep throat, but are futile against the viral nature of the flu. Antiviral medications may lessen the flu's severity if administered early. Accurate identification via throat swab for strep or a rapid flu test is essential to ensure correct treatment and prevent complications such as rheumatic fever from strep or pneumonia after flu. Common symptoms: throat pain versus systemic. Strep throat, primarily caused by the bacterium Streptococcus pyogenes, is characterized by a sudden onset of sore throat, pain on swallowing, and high fever without the cough that often accompanies flu. Unlike strep, influenza, caused by the influenza virus, brings about a range of systemic symptoms. Flu sufferers typically experience fever, chills, muscle aches, fatigue, and respiratory issues like a dry cough and a runny or stuffy nose. While both conditions can share the complaint of throat pain, the presence of other systemic symptoms can be a key differentiator. Flu tends to affect the entire body more extensively, whereas strep throat's impact is more localized to the throat, with associated tender swollen lymph nodes in the neck. Contagion period, incubation versus active. Understanding the difference in contagion periods for strep throat versus the flu is crucial for effective containment and treatment. Strep throat, caused by Streptococcus bacteria, usually has an incubation period of 2 to 5 days and remains contagious until antibiotics have been taken for 24 to 48 hours. In contrast, influenza has a shorter incubation period of 1 to 4 days, but individuals can infect others a day before symptoms appear and up to 5 to 7 days after becoming sick. This means flu sufferers can transmit the virus without knowing they're ill, potentially leading to wider spread before precautions are taken, a critical insight for public health strategies during flu season. Treatment approach: antibiotics versus supportive care. When distinguishing between strep throat and influenza flu, the treatment approach is a key factor in medical management. Strep throat, caused by the bacterium Streptococcus pyogenes, specifically calls for antibiotics to eradicate the infection and prevent complications. Penicillin or amoxicillin are commonly prescribed. In contrast, the flu, a viral infection, doesn't respond to antibiotics. Treatment primarily focuses on supportive care, rest, hydration, and medications to alleviate symptoms like fever and aches. Antiviral drugs like oseltamivir, Tamiflu, may be used within the first 48 hours of symptom onset to shorten the duration of the flu. Distinguishing between the two based on symptoms and rapid diagnostic tests is crucial to avoid unnecessary antibiotic usage and to provide the most effective treatment. Typical onset: abrupt versus gradual. When distinguishing between streptococcal pharyngitis, strep throat, and influenza, the flu, the onset of symptoms provides crucial diagnostic clues. Strep throat typically announces itself suddenly, with individuals often able to pinpoint the exact moment symptoms began. Sore throat, difficulty swallowing, and fever usually come on rapidly, Conversely, the flu often starts more insidiously, with symptoms such as body aches, fatigue, and chills that progressively intensify over a few days. Whereas strep throat's hallmark is a severe acute sore throat without the cough common in respiratory illnesses, flu symptoms are more systemic and respiratory in nature, including a notable cough, which helps to differentiate it from the sharp onset of strep symptoms.